Hello, my friends. This is Dr. B, the best doctor in medicine, 30 plus years of experience in medicine. Today, Dr. B wants to talk to you about your heart failure. Yes, you heard very, very well. Right now, whether you're a man or a woman or anything in between, you might be in heart failure, but you don't know it. Isn't that crazy? Isn't that crazy? Heart failure, but you don't know it, right? It's kind of like people who are walking around, they are happy, but there's a cancer growing in their body, and they have absolutely no guts or clue that they have a cancer, but the guy is walking around, right? He's happy, he goes to work, he goes to the barbecue this weekend, he goes with his wife on vacation, he comes back after 2 weeks in Europe, blah, blah, blah. But the cancer is slowly growing in his body until pain, blah, 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 blah happens, right? And then he realizes something is wrong with him. He goes see his doctor. By that time, it's already too late. When the cancer becomes symptomatic, in medicine, symptomatic means that causes pain, bleeding, blah, 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 discomfort, tummy ache, a headache, blah, blah, blah. Right? Depending on the type of cancer, obviously. Or a lump, like the woman now, she feels a lump, right? You know what I'm saying. Depending on the type of cancer, the symptoms are going to be different. The way the cancer reveals himself to the patient, and the patient realizes, you, my friend, you realize that something is definitely wrong with you. I have to go to the emergency room, or I have to go to see my doctor because I know that there's something wrong with me now. By that time, it's late. That's why we do cancer screening, to detect cancers early. I posted some videos about cancer screening. Please watch them. Follow my recommendation. Follow my advice. Dr. B loves you. Today I want to talk to you about this hidden silent heart failure that you have, but you don't know it. And guess what? Your family doctor, your internist, he doesn't know it either, or she doesn't know it either, right? Isn't that crazy that just like a cancer can be in your body and you don't know it right now, you can be having right now heart failure, but you don't know it. You see, Dr. B is an expert in cardiovascular imaging. I work in a cardiac and vascular clinic, big clinic, beautiful clinic, right in California, in Mountain View, California. We specialize in cardiovascular diseases. We have a huge cardiovascular department. We see dozens of people every day, different ages, right? For different heart problem, vascular problem, vein problem, artery problem, the entire cardiovascular system we specialize in, right? Every day I see patients who come for different reasons, right? They've been sent by their doctor or that doctor or referred by another doctor, blah, blah, blah. And I tell the patient, but you know what? Because I checked the heart, right, with the ultrasound probe. The guy had his EKG. And I tell the patient, you know what, sir, you're having heart failure. And the cardiologist is going to talk to you. We're going to need to do more exams. The guy is stunned, or she is stunned. What do you mean I'm having heart failure? But I feel okay. I'm very good now. Nothing happens. My doctor sent me just because my blood pressure was not under control, or because I've had diabetes for a long time, or because he heard a murmur in my heart. He heard a murmur. So the guy goes to his family doctor for a routine checkup. The family doctor listens to the heart, right, and hears a murmur. and send the patient to our cardiovascular clinic. We, the expert in cardiovascular medicine, we diagnose the patient with a stage B, A, B, C, D, right? With a stage B heart failure. At the stage B of heart failure, right, the patient doesn't feel anything, right? It's only at the stage C of heart failure that a patient starts to feel shortness of breath, cannot even go up the stairs, right? Cannot even swim anymore, gets tired, has some discomfort in the chest, right? After just walking half a mile, right? That's already late stage, right? You want to find a heart failure at the early stage, right? You want to find heart failure at the stage A or at the stage B. You don't want to be diagnosed when your heart failure is already stage C, right? Because it's late. It's like the cancer you want to detect early. Once the heart failure is at the stage D, D like dog, right? D, it's too late. Your only chance of survival is having different procedure like an LVAD. I don't want to go into the details, or a heart transplant, but that's it. You're done. You're done. You're just gonna die if they don't do a heart transplant or they don't put a special artificial pump to take over your heart. We call that the LVAD, LVAD, left ventricular assist device. So you either have the LVAD, artificial mechanical pump that you have to carry every day with you, right? Or I mean, not the pump that you carry with you, the battery, right? The pump is put inside your chest, but you need to carry this huge battery connected to this freaking mechanical pump inside your chest, right? Or you have to wait for a heart transplant. It's too late. So you want to detect the heart failure at the stage A or B, right? Not wait for the stage C, right? When you have shortness of breath, you can't even go up and down the stairs. You can't even go have sex with your wife. You can't even carry the groceries, right? That's too late, right? So I see a lot of patients in stage D. And I tell the patient, look, sir, you have stage D heart failure. Like detecting a cancer kind of early, but not that early, right? And the guy is stunned. Now, thank God we detected that heart failure at stage D, at stage B, right? B like Bob, and not stage C or D, right? Because the patient was sent kind of early, right? So remember, the point is to teach you that it's not because you don't have shortness of breath and you are okay climbing 2 flights of stairs, climbing to the second or third floor of your apartment, that you don't have heart failure. Because heart failure is like cancer. It comes with different stages. And we need to detect heart failure at the earliest stage, stage A. Or at least stage B, but not stage C, not stage D. By then, it's very late by then, right? It's like a cancer, right? You want to detect the cancer at stage 1 or stage 2. Stage 3 and stage 4, it's too late. Like Joe Biden. This guy, his cancer is stage 4. That's it, he's done, right? He's not going to enjoy his retirement. That's it. Stage 4 prostate cancer. It's unbelievable, right? Or the woman who didn't do her mammogram and gets diagnosed stage 3 or 4 breast cancer. It's a disaster. Chemotherapy, radiation therapy. So it's just too late. She's not gonna survive. Even if she survives, she's gonna relapse. The cancer is gonna recur in a few months or year. Eventually she'll die, right? You want to detect breast cancer or any other cancer, stage 1 or stage 2 or a little bit, I don't want to go too much into detail of classification of stages of cancer, but you get my point. Right now, you, whoever you are and watching me, you might have stage B or stage A heart failure, right? And you feel okay, right? But your family doctor needs to send you to our clinic so that we can detect that heart failure. Now you're going to come to the clinic and you're going to tell me, well, I feel pretty good. How come you are telling me that I have stage B heart failure? And then I'm going to show you the ultrasound of your heart. And the ultrasound of your heart not going to be beautiful. I take the ultrasound probe. I'm an expert in cardiovascular ultrasound, Dr. B. I'm going to put it on your heart and I'm going to show you what is wrong with your heart despite you feeling okay, right? And then we're going to put you on the treadmill. We're going to do what we call a stress test. And we're going to make you run at different levels of intensities. And you're going to find out that you are okay for daily walking, going up and down the stairs, a few stairs. But then when you go on the treadmill and you start to run at a higher and higher intensity, you're not going to make it. You're going to be quickly having to stop because of massive shortness of breath, right? Because your heart is no longer able to pump blood at a sufficient level during exercise because you are having heart failure stage B. So at the stage B, you feel okay, nothing wrong with you. Your family doctor doesn't even suspect that you have heart failure, right? But then when you come to our clinic and I put you on a treadmill to make you run, you're not going to make it. Or when I do the ultrasound of your heart and I show you your heart on the screen and I show you a normal heart to compare, right? I'm going to take the probe and I'm going to show you my heart. I do that a lot for patients who have this kind of issue. After I'm done with them, I show them the pictures of their heart, right? And then I show them my heart. Dr. B, 50 years young. I have the heart of a baby, like a baby, beautiful heart, right? And they can see the difference. They say, my God, now, Dr. B, I can see the difference between my heart and yours. I thought I was okay, but no, he wasn't okay. It's like the guy who is walking around, right, having a cancer growing. He doesn't know it. So this guy is having heart failure, but he doesn't know it because it's still not a stage C. So he feels okay, takes his dog up and down the stairs, and he goes on vacation with his wife. He's okay. He never goes to the treadmill because he's not an athlete and he doesn't go to the gym. He has a good life. So he doesn't know that he has stage B heart failure until somebody sends him to our clinic. Guys, I told you in another video, please watch it. Follow my advice, follow my recommendation, watch my videos. I teach you in easy ways to be healthy. I posted another video about why you need to request your family doctor. If you are 50 years and above and you have never been to a heart specialist, cardiologist, that's unacceptable, whatever you want to say it. You need to request your family doctor to send you to a cardiologist, even if you feel okay, right? 50 and above, of course, younger if you have risk factors, diabetes, high blood pressure, high cholesterol. How can you not be sent to a cardiologist? It's crazy, right? Your family doctor, your internist are not heart specialists. They are family doctors. They are internists. They have their limitation in knowledge and skills, right? They are busy running their business. They see 40 patients a day. They are busy making a lot of money to run the business so that he can save for his retirement, go on vacation, pay the bills for his clinic, right? He needs to pay the rent, pay the nurse, the receptionist, the medical assistant. He's busy. He doesn't have the time to take care of you the way it should, right? What we call personalized, tailored medicine means personalized, tailored medicine to you. So he puts all the patients in the same basket. So you are 50, 55, 60, 65, 70, 75. Oh, my blood pressure is controlled by medication. My diabetes is controlled. So my doctor said there's no need for me to be sent to a cardiologist, to a heart specialist. I feel okay. What do you mean you feel okay? But maybe you have heart failure and you don't know it, and your doctor doesn't know it, right? Only a heart specialist can detect heart failure at an early stage. And I posted a video about maybe you have obstruction in your heart, and you don't know it, and your family doctor doesn't know it. Only a heart specialist, a cardiologist in our cardiovascular clinic, we are expert in this, can detect that you have obstruction of the arteries of your heart, so that you don't wind up in 6 months or 1 year or 2 months with a heart attack and die before your retirement and enjoy your life, your retirement and your money, right? Guys, please be in charge of your health care. Don't put everything 100% in the hands of your family doctor, right? Trust your family doctor, but grab the bull by the horn, right? Get in charge of your own health care, right? Because your family doctor has its limitation in time, in knowledge, right? So you need to request your family doctor to send you for a visit to the cardiologist if you are 50 and above. Younger if you have risk factors, smoking, alcohol, even the so-called social drinking, right? What does that mean? It doesn't mean no cats or social drinking. What does that mean? Everything is relative, right? What is social drinking for someone is alcohol abuse for another guy, right? High blood pressure, diabetes, smoking, blah, blah. Even if you're younger, then if you have any of these, you need to go see a cardiologist so that we do an ultrasound of your heart. We need to do an EKG. We might need to do a treadmill exercise test, right? So you might have heart failure stage B. You don't even know it until you come to our clinic and I check your ultrasound, your heart by ultrasound, and I put you on that treadmill to do an exercise stress test. Then you're going to see that, my God, your heart is not normal, right? You have to do that before you get into the stage C of heart failure, which is overt heart failure. Means you feel so, you just can no longer go up and down the stairs. You can no longer walk your dog more than 20 yards. That's late, right? We need to detect cancer early. We need to detect heart failure early at stage A or B. And that requires you to ask your family doctor to send you to a cardiologist for a screening. You feel okay. Oh, you're okay. Okay. Come for a screening. The same way you go see your urologist every year to do a PSA, to put a finger in your butt, to check the size of your prostate. Or if you're a woman, you see your gynecologist regularly to do your pap smear, to check your boob, to do an ultrasound of your ovaries, right? We need to detect everything early. But if you don't tell this to your internist or family doctor, they're not going to do it. The guy is busy running a business, right? He's seeing 40 patients a day, and the average time a patient spends inside the exam room is 5 minutes. Statistics of the American Medical Association, after the guy spent an hour waiting in the waiting room. But he spends only 5 minutes talking with the doctor, being examined by the doctor. So your doctor has his limitation in time, knowledge, skills, right? He's not a heart specialist, right? You have to nicely, politely, in a civil way, request your doctor and say, how come, doctor, I'm 60 years old? How come, doctor, I'm 60, 65, 70, 80? Doesn't matter. Doesn't give a cazzo. Or I'm younger, but I have risk factors for heart disease, for cardiovascular disease, for heart attack. How come you don't send me to see a cardiologist? Request that to your doctor. And if your doctor doesn't want to do it, you pick up the phone, you call your insurance company, and you change your doctor. My previous dentist was no good, right? Just do quickly, doesn't take care of my teeth, right? The nice way. I changed. There's millions of dentists. There's millions of family doctors. There's millions of internists. Change. Get one that will take more time to be with you, that will not rush you in and out of the room, right? That will listen to you, that will take his time to explain to you, that will take his time to explain to you that, yes, I think we definitely need to send you to a cardiologist, a heart specialist. If everything's fine after that, then that's okay, then you're done, right? It's like I go to my dentist many times, right? Every 3 months, even if I feel okay with my teeth, right? The woman has to go see her gynecologist even if everything's okay, to do her pap smear, her screening, right? We need to have screening in medicine. Medicine, guys, modern medicine should be individualized, tailored to the patient, right? But it's not, because medicine in America is going down the drain. It's becoming a disaster. And the reason is very simple. We are now 350 million people. And every year our population is growing. Our national debt is now $37 trillion, growing every year by $1 trillion. Every state, including the California state of California where I live, is bankrupt. We have a massive budget deficit here in California, and every state the same. Millions of veterans don't have insurance. Even if they do, they don't have access to healthcare. Millions of veterans are homeless. Millions of homeless people, millions of poor people, right? 30% of the American population lives below the level of poverty. It's crazy. 30%. In California, we have the highest rate of poverty. We have the highest rate of homelessness, right? Even in California, right, people who do have insurance provided by the state, the so-called free taxpayer-sponsored healthcare, they don't have access to good medical care, to good prevention. So they die of heart attack because it's detected too late. They die of cancer because it's detected too late. They die of heart failure because it's detected too late. It's a disaster. We have a budget deficit in California that is crazy. So we cannot provide in any state of our union and the federal government or state, we cannot provide good quality health care to everyone. It's impossible because there's just too many of us and we have so much national debt. There's no money. Money doesn't grow doesn't fall from the sky, right? Doesn't grow on trees, right? And guess what, my friend? It's going to get worse every year. Worse and worse and worse. Believe me. Anybody who tells you anything else is just lying to you. These politicians are lying to you, right? Because our population is growing and our national debt is growing. It's impossible to provide free, universal, great health care, tailor-made, state-of-the-art healthcare with dental, vision, ear, prevention, surgery, medication to 350 million people from the cradle to the grave. It just doesn't happen. It's not going to happen, right? It's just not. Anyways, you are responsible for yourself. Don't give your body, your mind, your healthcare 100% in the hands of your doctor. Get in charge. Get knowledgeable. Right? So watch my videos. Listen to my recommendation. Listen to me. I know what the cazzo I'm talking about. I've been in medicine for 30 plus years and I'm here to help you. I went into medical school because I love medicine. I love human beings. I love to help. I love healthcare sciences. Regardless of your gender, your ethnicity, your race, your religion, the color of your skin. I don't give a cat. So I love you. I give a big hug to you. I am here for you. I hope to talk to you in the next video. Put your comments and question down there. I will get back to you. I promise it might take time because I'm so busy at the clinic, and I have to also sleep 9 hours a night, go to the gym, blah blah blah. So busy, it's crazy, but I love it. I love my life, my busy life. God bless you. I give you a big hug. I talk to you in the next video. Bye bye.